Bismillahirrahmanirrahim. Assalamualaikum everyone. And today we'll be talking about sex hormones. So the learning outcomes for this time is to describe the production, metabolism, actions of androgens, production, metabolism, actions of estrogen, production, metabolism, action of progesterone, and physiological basis of use of these sex hormones as birth control pill and hormone replacement therapy. Let's discuss about androgens firstly. Androgens are male sex hormone and there are many types. I've listed down here. So you have testosterone, DHT, it's dihydrotestosterone, androstenedione, dihydroepiandrosterone, DHEA, and dihydroepiandrosterone sulfate, DHEAS. And on a daily basis, we have about 8 milligrams of testosterone, and in male, you have 0.6 microgram per deciliter in male and about 0.03 microgram per deciliter in female. And it's about 65% are bound to sex hormone binding globulin and about 2% is free. And when you say it's bound to SHBG, it means that it's not free to provide the effect, to have an effect. So the hormone must be unbound to the binding globulin, and therefore you bind to the receptors and then have the effect of that hormone. Right, so let's talk about how the hormones are being produced. So I'm showing you this pathway, but this pathway, I'm going to show you this multiple times because the pathway is the same for all sex hormones. Let me highlight them. The first one that you see is the progesterone. Progesterone is, if you can recall in my previous lecture, title menstrual cycle, we talk about progesterone, and we also talk about the estrogen, and estradiol is the active estrogen. So we have progesterone and we have estrogen, and it's in this same pathway, is the same process. It comes from the same precursor, which is the cholesterol. So I've highlighted here, same precursor, cholesterol. You get to produce the female sex hormone. And look at this side, you can see all the androgens, right? We talk about DHEA and androstenedione, testosterone, and DHT. All these are the androgens. And notice that it comes from the same source, cholesterol as well, and with the with a certain enzyme, it becomes androgen, right? So from the same precursor, undergo a few different pathway, but slightly different from one another, but it comes from cholesterol and then pregnenolone, and then it differentiates into it undergo process different, slightly different process to produce whatever you want to produce. But see that we've talked about in the menstrual cycle lecture that estrogen is being produced by androgen. Estrogen is being produced by converting androgen to estrogen, and this is what this is clearly showing you the androgens. How is it being converted to estrogen? Right, so the androgen metabolism. Androgen, the active form of androgen is the dihydrotestosterone, DHT, and the rest of these other forms of androgens are inactive. And the androgen, when it is not being used or is not needed, it is being converted to the inactive form, and this is how androgen is being metabolized. And androgen are being metabolized in the liver, in the kidney, in the gut, muscles, and adipose tissues. Right, so what does this testosterone actually do? And mainly when we say androgen, we always refer to testosterone in general. Right, so it starts off in a womb. It helps in the development of male reproductive organs in a fetus, and is also responsible for puberty, spermatogenesis, and erectile function, and also development of secondary sex characteristics. I put there one is the development of hair in the pubic area, axillary area, facial, arms, legs, and chest. Secondly, the growth of voice box. Thirdly, male pattern fat distribution. So we're talking about the abdominal area. And then fourth is muscle growth. And fifth, increase in sex drive. So from an undifferentiated gonad, for example, if an ovum and a sperm combines and it forms XX, so it means it's female. If it's female, you have no inhibition, and so the female reproductive organs will develop. So the fallopian tubes, the uterus, the upper vagina. If, for example, a combination or fertilization of the sperm and the ovum, and it produces XY, right? And so this is male, and you have that Y gene there. So Y gene will cause the anti-Mullerian hormone to be produced. Anti-Mullerian hormone, as you can see, the name says anti-Mullerian hormone. So it means that it is against the Mullerian duct, the formation of the uh, female reproductive organs. Therefore, with this inhibition, you have development of the male reproductive organs taking place. Therefore, you have the testosterone being secreted, and this leads to the development. This helps in developing the male sex organs. The epididymis, the vas deferens, the seminal vesicles. Right, so this is the HBO axis, and the HBO stands for hypothalamic, P stands for pituitary, and O is for the organ. And so the organ here in particular is we're referring to the testes. Right. So we also have the HBO axis in the female, and that is I think I've talked about that in my lecture, menstrual cycle, and the organ in concern is the ovary, right? So in this case, we have the testis. Okay, so similarly with the female, you have GnRH, it's gonadotropin releasing hormone, and similarly they influence the secretion of FSH and LH. And FSH is follicle stimulating hormone, and LH is the luteinizing hormone. And what they do is that FSH stimulates the production of androgen binding protein ABP, and it also enhances Sertoli cells to help in the spermatogenesis. And the function of Sertoli cells is that they nurse, they help the gametes to grow into mature gametes, and in this case we're talking about the sperms. And LH, on the other hand, it has an influence on the Leydig cells. So the Leydig cells, once stimulated by LH, it will produce testosterone, and testosterone is the hormone that is important also for Sertoli cells. Similar with Sertoli cells, it helps in the spermatogenesis. And apart from that, it also causes all these secondary sexual characteristics that you see in male when they reach the puberty, right? And all these effects are inhibited by inhibiting the same hormone, which is also inhibited in the HBO axis in the female reproductive system. And also the hormone itself, testosterone itself, can also impose negative feedback on her hypothalamus and also the pituitary, the anterior pituitary, from producing further FSH and LH. Right, so what does testosterone do other than its primary function in producing, in helping in producing sperm and also the development of the male sexual organs? It also promotes protein synthesis and growth of structural tissue, and growth of muscle mass and improved strength, and this is like really significant if you compare to women. And I'm saying this is very significant because it's true. I mean, even though you compare yourself to a man who does not exercise, who are not strong in particular, who does not have he's not that muscular in particular, but they as men, they have significantly more strength than us girls. I mean, I'm talking about the girls. If you're girls and even though you work out and you know that you're strong, but you know, and you ask any man to do strength workout with you, and you find that they can do much better than you, even though they're not used to that workout. If they're not used to heavy stuff or heavy material. They're not used to carrying heavy stuff. But yes, there's a lot of difference, and it's very significant, and men generally have more strength than women. And testosterone and bone, and it prevents testosterone also prevents bone loss. It stimulates osteoblast and stimulates production of growth factor in bone, and it improves strength. And talking about osteoblasts, and we've talked about, I don't know whether you have learned about osteoblast, about bone osteoblast and osteoclast, but if you have not, generally osteoblast is the cells that are important to to build and strengthen the bone. And we also have osteoclast. Osteoclast is important for to increase the level of calcium in the blood. So it is doing that by taking out the calcium from the bone and releases it into the blood. This is also another picture that I want to show you, that testosterone will make you happier, you have a sharper mind, and more confident, a healthy heart, and strong erections and healthy libido, strong bones, and you have plenty of energy. All right, so testosterone relation with heart, this is quite, I mean, this is not, I would say, really confirmed yet, but it does have a relation with the heart, and some research shown that the testosterone has good effects on the heart in a way that it reduces heart problems. But some research are also showing that with testosterone, uh, you have a higher risk of having, for example, heart valve diseases. But we don't know because it can be affected by other factors as well, and you have to take into account other things like diets and their lifestyles, and what are other risks that are involved. For example, the main risk that might be directly connected to the heart itself, rather than looking at testosterone level. Testosterone are also related to insulin activity, and as insulin increases, testosterone decreases, and may decrease insulin resistance and help reverse diabetes. And I put may again because this is, I would say, multifactorial. I mean, it cannot just be testosterone alone. There are so many things that can also, influence this performance. All right, so now the testosterone and brain. male brain is larger. I think this is, generally because men are larger than women in general. So you have definitely a larger brains, right? Improves thinking, prevents depression, and improves sense of well-being. I think this is for both male and female. Both the male and female hormones, sex hormones, helps in preventing depression and improves sense of well-being, and also in mental sharpness, assertiveness, memory, ability to make decisions, ability to concentrate and focus. All right, so let's move on to the female sex hormones. All right, as for the females, let me introduce to you the ovary and what are the cells are involved in the production of estrogen. And I've mentioned this before in my lecture on menstrual cycle, but I'm gonna explain to you again. Um, the female sex hormone, right? So this, what we're looking at is the inside of an ovary. So we're looking at in the middle you have the oocyte, and if you look at these this thing here, this is actually the Graafian follicles. Why I'm saying it's a Graafian follicle because it's really large, and you have a big space here, and this is the space where it's filled by fluid, and this is called antrum, right? And you have the oocyte right here in the middle, and surrounding it is the lots and lots of cells, and we call that the cumulus oovers. And you have these granulosa cells, right? Just around there. And then you have the theca cells, right? The theca cells and the follicular cells are the cells that are involved in producing estrogen. And when we talk about the female sex hormone, they are two, the estrogen and also the progesterone. But particularly, we always, when we say female sex hormone, we are referring to the estrogen in particular, estrogen as the primary hormone, because progesterone is the pregnancy hormone. Is uh, the name implies that it's progesterone, so it's for gestation, for pregnancy. So it's a pregnancy hormone, but the female primary hormone will be the estrogen. Right. So the theca cells, like I said earlier, the theca cells and the granulosa cells are the cells that are involved in producing estrogen. And we'll get back to how estrogen is being produced later on. So this is the pathway of estrogen production. The pathway is actually very similar to the one that we saw in the previous slide that I've shown you, the common pathway of all the sex hormones production. From cholesterol you have the pregnenolone, and then progesterone, and then from progesterone you have the androgens, and from the androgens you can make estrogen. And this one is a simplified version of that diagram. This is including the hormone as well. So as you can see, you have the FSH and LH here. So it starts off with the LH stimulating the theca cell to produce androgen from the cholesterol. So and then this androgen will go to the granulosa cells. Granulosa cells, under the influence of FSH, will produce estrogen from androgen with the help of the enzyme aromatase. Alright, so let's talk about the estrogen now. It is produced primarily by the ovaries, also produced by placenta, adrenal gland, breast, and fat cells. And mainly estradiol is the active form of estrogen, and you have estrone and also estriol. Maybe you want to tell me where can you find estrone and where can you find estriol. You can WhatsApp me, or you can just comment in the comment section below. And then the normally level of estrogen are about 50. This is before one reaches puberty. Some books may put less than 50, maybe about 20, or maybe less than that. but I put 50 here, 50 picogram per milliliter. When you reach puberty, it's usually about 350 to 850 picogram per milliliter. So again, we're coming back to the same pathway, let's say the common pathway of the sex hormones. And again, I want to highlight that they are being produced from the same source, the cholesterol. And you just have to remember the main thing: cholesterol converts into pregnenolone, and pregnenolone converts to progesterone. And from progesterone, you have the androgen this side, androgen area is this side, right? And finally, from the androgens, you have the estrogen, right? So cholesterol, pregnenolone, progesterone. From progesterone, you have androgen. From the androgen, you have estrogen. So basically, that's that. Right, so estrogen also binds to sex hormone binding globulin, and I think I've introduced sex hormone binding globulin earlier. It also helps in transporting testosterone. So also it transports estrogen. And you also have albumin. Albumin transport almost almost anything in the body that needs transport. So albumin is a very important protein, and it is converted to estrone and estriol by liver. And this is, remember, this is the an inactive form of estrogen. So when it's not needed, it is being is in this form and excreted in the bile or reabsorbed from the intestine. Right, so apart from the main function of estrogen, what are other functions of the estrogen, right? So we've talked about the first one: growth of follicles in the ovaries, yes. Uterine muscles and endometrial lining, yes. Growth of external genitalia and breast, yes. The female fat distribution pattern and accelerated growth phase. The female fat distribution pattern, for female, fat is being distributed on average in the hip area and lower part, which is the bottom hip and your back. So that's the female fat. More on average, the fat is being distributed there more. And also you have growth of axillary and pubic hair, pubic hair area. So pubic area and also the axillary area. Right, so just like testosterone, estrogen are also related to the heart. It was reported that estrogen can dilate and protects blood vessel by increasing the HDL, and HDL is the good one, and it decreases lipoprotein. But again, I think that it is multifactorial, and it probably has, yes, some effect, but again, it's also depending on other factors as well. All right, again, similar to testosterone, estrogen also has the same effects in bone loss, and with estrogen, it maintains balance between osteoclast and osteoblast. And earlier on, I've mentioned about osteoclast activity and osteoblast activity, right? And it's also involved in the closure of epiphysis of long bones. And this is also true with testosterone. Testosterone is also involved in the closure of the epiphysis of long bones. And estrogen is very related to skin, and it maintains elasticity, thickness, and moisture, and is needed for proper vaginal secretion. And this is really true because that's one of its function of estrogen, right? And also development of pigmentation, right? So when you hit puberty, you have a lot of acne and so on and so forth, right? Estrogen also is related to brain, Estrogen, just like testosterone, I've informed you earlier that it increases happy molecules. Basically, it makes us happier, it makes us more confident in ourselves. It makes us, it makes us feel good. Prevents depression and all that, right? And estrogen here I've put in my notes, it prevents dementia and Alzheimer's disease and may improve attention deficit. And other effects of estrogen, it stimulates adipose tissue production of leptin and enhance the coagulability of blood, induce the synthesis of progesterone receptors. And this is true. Remember, I've talked about this in the menstrual cycle lecture, that it causes the synthesis of progesterone receptors in the womb, especially in the uterus. All right, so now let's talk about progesterone. Is also produced by the ovaries, and I'm sure you know by now, remember the common pathway of all the sex hormones. Yes, so progesterone is made first, right? So you have the cholesterol, and then cholesterol being converted to pregnenolone, and from pregnenolone you have progesterone. So they are also made by the ovaries, and also testes and adrenal. Prepares for pregnancy, like I said, progestation, right? And it maintains pregnancy. Breast tissue differentiation, and in the male you have for about 0.03 microgram, and in female you have slightly more than that, 0.5 to about 2 microgram. Right, so progesterone is being converted to pregnandiol and conjugated with glucuronic acid in the liver, and this is the inactive form of it, and if it's not being used, and then excreted as pregnandiol glucuronide. All right, the main action of progesterone is, of course, we've talked about in my lecture on menstrual cycles. Yes, it is involved in the menstrual cycle, and its function there is to prepare the uterus for in case there's fertilization and there's pregnancy. So it prepares the body for the pregnancy. It's responsible for alveolobular development of the secretory apparatus in breast. And before that to occur, you need first to have the progesterone receptors being deposited first, and that is done by the estrogen. It participates in pre-ovulatory LH surge, and it causes maturation and secretory changes in the endometrium. And I think this is the main function of progesterone, is mainly for the endometrium first. So this is the main, and then the second that comes after that is the its role in the breast. Progesterone is also related to brain. It calms brain and improves sleep, protects the nervous system, protects and rebuilds the BBB. BBB is the blood-brain barrier. Decreases cerebral edema, inflammation, and also cell death. Right, and other effects of the progesterone includes it stimulates lipoprotein lipase activity, favor fat deposition, and facilitates insulin activity, promotes glycogen storage in liver, and compete with aldosterone receptor, causing decrease in sodium reabsorption, and increases body temperature, increases ventilation. And if you notice that I've put in here favor fat deposition, and this is, I think, important in case that for a woman to get pregnant and all, you need to have a certain amount of fat in your body. You cannot be skinny, and if you're skinny, you notice that the hormone production from your body is not normal. So you have to have a certain fat, a certain amount of fat for you to be able to be okay or to be accepted and to go through pregnancy. And also, there's another point that I want to highlight here is the increases body temperature. And I've talked about this in my lecture on menstrual cycle as well, that the progesterone has this effect. If you do chart your body temperature accordingly, your menstrual cycle base body temperature for your menstrual cycle, right? If you do that, you notice that there's a slight increase for at least 0.5 degrees Celsius increase when progesterone is around, when the progesterone takes place, right? Which is after ovulation. It signals. So when you sense that there's an increase in body temperature, there's a slight increase. Usually people use that, to see whether they ovulate or not, as indicator for ovulation. And there are also other ovarian hormones. For example, you have the LH and FSH, and we've talked about that earlier on. That is also involved in the in the HBO axis, right? And inhibin inhibits this sex hormones activity, inhibits its secretion. And then you have activin. Activin is the opposite of inhibin. Activin activates the release of FSH. And you also have relaxin. Relaxin is a hormone that is produced from the ovary and also from the placenta, and its function is to relax the ligaments in the pelvis, and which is important during childbirth, gestation. I mean, not gestation, is important for labor. It relaxes the ligaments in the pelvis, and it softens and widens the cervix. All right, and this is the overview of the HBO axis that I've talked about earlier. And this is also mentioned in my lecture on menstrual cycle, particularly the positive feedback and negative feedback from the estrogen release. And for progesterone, you only have the negative feedback on the LH and FSH release from the pituitary, and also from the on the hypothalamus for the GnRH release. Right, so what happens to the level of hormones as we age? So as we grow older, the sex hormones productions becomes less and less. It reduces in its production. So we undergo what we used to have, we used to be happy and all that. We have hormones that cause us to be happy, and prevent us to feel depressed and to feel sad. So you know that when these hormones come down, the level comes down, you have depression, hot flashes, a lack of sex drive, migraines, PMS, and so on and so forth. And similarly in men, although usually we mention, the women's significantly, but less significant in men. But actually, men do have somewhat a menopause too. But particularly in women, because women will be experiencing it more because they stop producing it abruptly. But for men, they still have that production, but not that. It reduces gradually compared to the sudden reduce in the hormones level in female. Right, so this is again showing you the effects of losing the hormone or having that reduction in the sex hormone for both men and women. And there are ways to overcome this, and usually the most and common ways of overcoming this is using hormone therapy. hormone replacement therapy. And for usually women, if they manifest I would say a severe symptoms, severe depression, and severe migraines and so on and so forth, they are usually advised to take hormone replacement therapy, and usually it's a combination of estrogen and progesterone. Sometimes it's just estrogen, but most of the time it's a combination. And similarly with male, we also have if they suddenly get involved in an accident or whatsoever that caused them to have the inability to produce the testosterone, they might have to go through the hormone replacement therapy as well. Right, so I've talked about the hormone replacement therapy previously, and the hormonal contraception is you using that hormones. We play around and we alter uh, the ability for one to get pregnant. So we prevent pregnancy. So the things that we use is that we use the hormones, but we play around with the menstrual cycle. And to and if we understand the menstrual cycle, we should be able to understand the hormones that we use in hormonal contraceptions. Alright, so these are types of hormone replacement therapy available. You have menopausal hormone therapy. You also have transgender hormone therapy, and there's androgen replacement therapy. Right, so for hormonal contraception, now the idea is that you use these hormones um, for contraception as well. You just have to play around. Once you understand the menstrual cycle, you can, control the hormone in a certain way, so that the cycle doesn't occur normally, like normally. So then this will prevent pregnancy. Right, so there are so many types of that, so many ways that it can be used to prevent pregnancy, and these are some of it that I have listed down. You have birth control implant. You can implant things inside, and the hormones that it releases is progestin. This is progesterone, and you can also have birth control patch. You can just patch it up, and then it will release estrogen and progesterone. You can also take birth control pill, sometimes in combination, or sometimes you just take progesterone only. And you can take also birth control shot. This one is like injection. Usually it's progesterone being injected into your body. And a common one is to use condom, but condom is the safest and is non-invasive, and it prevents, you know what it prevents. And then you have diaphragm. This is similar to the concept of if you have learned the respiratory system, you have your diaphragm. So it is something like that, but it's being put in your vagina area, and that prevents from the fertilization. It prevents the meeting of um, ovum and the meeting of sperm. Alright, so these are some more ways to for hormonal contraception. You have birth control sponge, birth control vaginal ring, and breastfeeding exclusively, but sometimes this doesn't work as well. You have cervical cap, simply just covering the cervix area with a cap, and we also have female condom. And then FAM stands for the family planning. The exact word is the fertility awareness method. Fertility awareness method. So this is called family planning, using the symptothermal method, for example, like charting your temperature. So this is family planning method. uh, and then you have IUD, intrauterine device, also using the hormone, releasing a hormone. And then you have abstinence. Abstinence means having no sex, but that, in for some people, uh, they won't be able to do that, right? Abstinence and other cause. And spermicide, you have you take something that kills the sperms. And then there's also sterilization, or if you do surgery, you do a vasectomy or tubal ligation. This is permanent usually, but for some people, sometimes they can reverse it, you can undo that. But I don't know, there will be risk involved, definitely. And this is the famous one, is a withdrawal method, meaning that they do have sex, but then after that, they take it out when it's with it's near the when the male is somehow when they somehow know when it's time to withdraw before the sperms gets inside. So basically that's that. Yeah, and that's about it. Thank you very much for listening to me. I hope everything went well for you guys. If you do have any question, and if you don't understand, especially my students, please, my number, WhatsApp me, ask me, and I will help in any way that I can, to help you understand. Thank you so much. Assalamualaikum, and have a nice day. Bye bye.